clinical psychology was really built on assessment. So in the 1950s, its role was didn't have a role in treatment, it had a role as assessing. So it was very much based on assessment in a rather kind of rigid and traditional way. But I think what's happened over the years, in the late 1900s, etc., was the development of treatments so that clinical psychology started actually treating folk. And more recently, measurement, I think, has moved away from traditional psychometrics as a priority towards utility.
If we look at recent history in written outcome monitoring and feedback, I think there are two key players, and those are Kenneth Howard, who's at Chicago University, and Michael Lambert, who's at Brigham Young University. In the context of managed care in the United States in the 1980s, there was a huge restriction in the number of sessions that insurance companies would reimburse. And that really triggered the discussion on how much therapy is enough. And because of that question, Howard started to think about, we need to have session by session measurements so that we can determine how much therapy is enough. And it might be that for some patients, those 8 sessions or so that were reimbursed at the time are enough, but for some patients it might not be. And so he had this idea as well that there might even be phases in change. So maybe at first patients get remoralized, they get hope that they can change. And then there's a phase where there is change of symptoms. And then there is a phase ultimately in which you kind of consolidate that and in which you make sort of the more structural changes. And so I think Howard was quite revolutionary in these ideas. And in order to kind of prove his ideas, he started developing these session by session measurements. And that all of a sudden enabled looking into, how much therapy do people need, but also what are patterns of change? Because all of a sudden that kind of data was available. And so Howard really did a lot of those sort of measurement-based developments. Then Mike Lambert came in and he was actually doing a sabbatical for a year in which he worked with an insurance company. So in that year, while working with that insurance company, they said, we actually need something in which we can determine how much therapy is enough. And so we need a system that enables us to kind of determine that. And that's how we ended up developing the outcome questionnaire, which was the first kind of real feedback system. And so it was actually developed in sort of collaboration with an insurance company, who obviously had they wanted to reimburse care, but they wanted to also know how much, and how do we know that we're not paying for something that's not delivering anything. And so and so that's how that started. So then they developed the outcome questionnaire, the OQ45, and started to give therapists feedback on it, because they thought, when we have these outcome measures, why not just inform the insurance company, but also inform the therapist that it might help them? And it turned out that it did. So getting that information about their patients' functioning actually led to improved outcomes. And I think that was sort of a little bit of magic happening there.